Hi guys, welcome back. This is Eleni, the Anatomy and Physiology tutor in the NIP program, and today I'm going to be talking to you guys about tendons, ligaments, and different types of movement. This is the last part of the musculoskeletal workshop, and it's just a very short presentation on the kind of extras of the musculoskeletal system. So we consider the tendons and ligaments and the fascia as other components. They're quite simple to understand. Tendons are going to be connecting muscles to bones, while ligaments are going to be connecting two bones at a joint. Now, a cool way that I found on the internet that you can be reminded of tendons and ligaments and whether it's connecting muscle to bone or bone to bone is that you want to eat a muscle. When you're eating like a muscle of a chicken or something, you want it to be tender. So that kind of reminds you of tendons. And then ligaments, just once you know the little tendons mnemonic, you can remember that ligaments connect two bones together at a joint. And then the fascia is the fibrous membrane covering, supporting, and separating muscle fibers. So let's first talk about some different types of movements. Abduction is when you're taking something away from your midline. So if you use your arm for an example, if you just hang it there on your side for a minute and then you take it away from your midline, you're going to be abducting it. Just think of someone who's being kidnapped. They're being abducted. They're taken away from their family. Abducted, you're taking your arm away from your midline. So that's shown here by this purple arrow. Adduction, obviously the word add, you're adding it to you, you're adding it towards your midline. That would be like if you take your arm that was just extended and add it back to your midline. Circumduction is a circular motion which combines different types of movement. You have flexion, extension, abduction, and all of those movements together are going to give you circumduction, which would be moving your arm in a circle. Now, movement part 2, dorsiflexion. That's when you move your ankle and toes towards your shin. So just lay your foot flat on the ground and then rise your foot up towards your shin. That would be dorsiflexion. If you have your foot flat on the ground and you turn the sole of your foot away from your midline. So not towards your sternum, but away, like away from your midline, that would be eversion. Inversion would be the opposite. That would be putting it towards your midline. Extension is obviously going to be straightening a joint and extending it, which can be seen in this picture. And flexion, just think you're flexing in the mirror. You're going to shorten a joint. And then over here we have external rotation and internal rotation. External rotation would be away from the midline and internal would be towards the midline. Okay, that concludes the last part of the musculoskeletal workshop. Thank you for watching and please go watch the other videos on the NIP Commons.